Why women should receive prenatal care. I'm going to urge all women who are pregnant or who will become pregnant in the future to receive prenatal care during their pregnancy. We all have a vision of what our perfect little bundle of joy will be like once it arrives. Wouldn't it be a shame for that vision to be taken away? That is why prenatal care is in place to help assure that that vision becomes a reality for expecting parents. I am a nurse that has worked in a maternity ward, and I've seen the devastating effects of little or no prenatal care. I am only going to educate you on how to prevent birth defects with prenatal care or get early treatment for birth defects with prenatal care. The truth is, we have all known or will know someone who has been pregnant if we ourselves have not been or will not become pregnant one day. I believe education is the key to preventing birth defects, and I'm going to provide you with some information on how every woman should receive prenatal care during their pregnancy. First, we'll talk about what prenatal care covers. We'll also talk about prenatal care and how it can be started before you become pregnant, as well as the birth defects that can be detected with prenatal care. What is prenatal care? Prenatal care is the health care you get while you're pregnant. Over the 9 months that you're pregnant, you'll visit your doctors a numerous amount of times. During the first 6 months, you'll visit that doctor once a month. During the 7th to the 8th month, you'll visit your doctor every 2 weeks. And then from the 8th month, you'll go every week until the delivery of your child. Now at that doctor's appointment, at those doctor's appointments, there's several things that happen. You'll discuss your health history with your doctor. You'll also have a physical exam as well as a pelvic exam. You'll receive ultrasounds. You'll also hear the heartbeat of your baby from the very beginning. Also, there will be blood and urine tests ran on you to detect any problems that you may be having with your health or with the baby. And those are the things that take place during those doctor's appointments for the prenatal care. Prenatal care can be practiced before you become pregnant. So before you have a baby, you can actually start getting in the habit of practicing prenatal care. You're probably wondering, what are those things that I can do before I become pregnant to practice prenatal care? You can start by taking a multivitamin, and that's any over-the-counter multivitamin. You can also start by having a healthy diet, and that's eating from all 5 of the food groups, a well-proportioned diet, as well as regular exercise. And what's regular depends on you and your body. That could be anything from working out at the gym 1 to 3 days a week, or just simply walking the block every other day. And another key to starting prenatal care or participating in prenatal care before you become pregnant is taking folic acid, which you'll need to take 400 micrograms a day to help prevent spina bifida before you become pregnant. And we'll talk about what spina bifida is more a little later. So going into what the actual birth defects are, we'll talk about what birth defects can be detected while you're pregnant. According to ACOG, which is American College of Obstetricians and Gynecologists, they say that women who do not receive prenatal care have a 3 times higher chance of having a low birth weight baby, which low birth weight is a baby that is less than 4 pounds. Also, Marchadine says that each year 150,000 babies are born with birth defects. So there are several different birth defects that can be detected with prenatal care. A few of those are spina bifida, like I discussed, which is when the spinal cord does not seal. Also cleft lip palate, which is where the tissues in the mouth or the lip do not close, leaving an opening in that space. A numerous amount of heart defects can be detected with spina bifida, as well as Down syndrome or mental retardation. There are hundreds of birth defects that can be detected during prenatal care. Now, not all birth defects can be treated or corrected with prenatal care, but it will give you and your doctor a more planned layout of what will happen when that baby is born with that birth defect. So in conclusion, I hope during your pregnancy or in the future when you become pregnant, you decide to dedicate yourself to prenatal care. So what we've discussed here about prenatal care, and it should also persuade you to participate in prenatal care, is what prenatal care is. We've also discussed how you can start prenatal care before you become pregnant, and what birth defects can be detected or prevented by prenatal care. So as a nurse, I plan to educate as many people, men and women, on how prenatal care can help decrease the amount of birth defects. Also, I urge you to read statistics and get as much educational information as you can on the birth defects that are present in the United States. You can find information on that at theacog.org. Also, marchofdimes.org. smartmoms.com has a lot of information on what different type of birth defects are out there and the prevention. Also, it has some information on how you can deal with that if your baby is born with a birth defect. Another site is womenshealth.com. womenshealth.org, which gives you information on women's health during pregnancy and preventative measures. So, in conclusion, I believe the key to prevent birth defects is knowledge about the different things that can happen when you do not receive prenatal care. So, prenatal care doesn't always prevent all of the birth defects, but it does help decrease the likelihood that your baby will be born with one. We all want to make that vision that we have of our perfect little baby become a reality. And once again, I believe that prenatal care is the key.